So pleased to see that you're conscious. My name is Dr. Doris Yancy. Welcome to the Syndicate of Science, otherwise known as SOS. Yes, we are an association of scientists who are dedicated to medical studies relating to abomination sciences. They said our methods were unsound elsewhere, so we moved to the middle of nowhere. Yes. One of my acquaintances found you outside, and we brought you in here to check you out. We'd like to run some diagnostic tests. Yes, I've already checked you with my otoscope, but if you wouldn't mind, may I also check your heart and lung functions with my stethoscope? Brilliant. All right, I'm just going to come in a little bit closer and put this on your chest. Now, breathe normally for me. Inhale. Exhale. Very good. One more. Inhale. And exhale. Very good. And once more. Inhale. And exhale. Lovely. Now I'm just going to come around to the back here and check your lungs. All right. Now, if you please, inhale. Good, exhale. And another deep breath. Inhale. Exhale. Excellent. Once more for good measure. Inhale. And exhale. Inhale. Good. Your heart rate seems a bit reduced, but considering the condition you arrived in, that is to be expected. Your lungs sound lovely, though. Not a common compliment, but now let's check your oral temperature. All right. Say ah. A little below average. I'll make a note of that. Next, while you were knocked out, I did do a primary scan of your body, and I did discover that you do have a microchip implant. They're very common here in the middle of nowhere, so we do have a scanner for that, but I need your explicit permission before I scan you, considering it is a subdermal implant. Excellent. I know it looks a little bit scary, however, it's just a standard chip scanner. It will help us determine some of the diagnostics if we are able to watch the playback. So, do I have your permission to scan you with the chip scanner? Brilliant. All right. Now, please, darling, hold still. Yes, be very careful. Don't want to hit it the wrong way. All right. Good. Good. Yes. Just have to locate the chip first, and then we will scan the information on it. I should make a sound when I am close. close by. Ah. Oh no, that is not the right side. Okay. It's in the side of your neck. Alright, I'm just going to. Good. Now I'm going to take that information and I'm going to run that through our computer while we do your labs. Here at the Syndicate of Science, we are a motley crew of conviviality, and my associates, Nurse Iris Garten and Nurse Kitty Newmar, would like to also perform some diagnostics on you so that we may determine what happened to you out in the middle of nowhere. I will be watching the playback of your microchip scan so that I can see through your eyes what happened. However, we would like to determine with conclusive evidence what may have happened to you, and a round of testing would help us with the diagnosis so that we may begin exploring treatment options. They're very friendly, I assure you. Yes, I will circle back for an additional round of testing after they have some conclusive results. I will be watching your playback and that will help as well. I'll send them in one at a time.
Hello, little lab. I am Iris. It is my job to get you through this line of questioning and exams in one piece. But Iris, I hear you say, where is the fun in that? I agree, you're delightful freak. Sadly, it is not that kind of exam or line of questioning. So unfortunately, we must begin. We put this aside. The first portion of the exam will be related to questions pertaining to the nature of spells, curses, hexes, and other things that may have befallen you out there in the middle of nowhere. Question one. Are you experiencing any demonic possession? I realize that the devil is a lie, and he could be deceiving me with his answer. But to get a little bit more into the nitty-gritty, have you picked up anything and then been compelled to say a incantation, maybe in Latin, there was a card with it? No, okay. That's very important. No demonic protection for you, as far as we know. Have you stolen any ancient artifact from maybe a old house or work site lately? Yeah, well, it would maybe lead you to becoming haunted, so we need to check that out. But you haven't had any sticky fingers recently, no? Sticky fingers, good. Along with those same lines, have you opened any canopic jars recently? Canopic jars, it is like it's like a mummy's cart, because it's where you put the mummy's organs, and then you haven't been in a pyramid recently, no pyramid schemes for you. That's probably good. Okay, have you eaten something that was maybe given to you by an elderly woman, like a witch, like a witch, and then you ate it and then you were bewitched? Okay, good. You have not recently accepted any fruits or baked goods from any unlicensed women of an older persuasion, because this is good. Have you stepped on a crack recently? I don't know if you do that, you can break your mother's back, so I would be very careful walking around here. Have you walked under a ladder? Yeah, just to cover up the bases, walking under a ladder. No, my good. Have you broken any mirrors recently? Well, that would be 7 years of bad luck. So we just need to cover, the next, do you have a 5-year plan? Okay. Well, no, okay, good, because that would deeply affect your 5-year plan if you've broken any mirror. Have you recently found yourself lost in a new IKEA with this maybe attacked by faceless entities that follow you around the store as we're closed? Yeah, that question kind of answers itself, doesn't it? You know, because you're here in front of me. So no, you're not lost in an IKEA. Do you have sleep apnea? Yeah, like you need a mask to breathe for you while you are, sleeping. No. Okay, well, just to make sure that you didn't put on any haunted sleep apnea mask recently. Have you downloaded any free apps onto your phone? Completely free from the App Store. Okay. Have you played with any technology that was not yours recently? Maybe a phone or a tablet that you found sitting around. Okay, that is probably very important to know. Yes, you have to be very careful with some of those apps. They're quite addictive and could become addicted to you. It's a vicious cycle. So, have you experienced any enchanted compulsion recently? Yeah, like if you were doing something and you're like, why am I doing this? Why am I doing this? But you have to get it done, and it's very out of character for you. Okay, no enchanted compulsion. That's probably good. No, you haven't found any dolls with your characteristics. That would. No, okay, good. And have you had any potions recently? You imbibed any spirits that could maybe be in a potion that would give you a duality curse, like a Jekyll and Hyde sort of scenario where, like you're losing track of time, you're being an asshole online, doing things of this nature. Okay, not to your knowledge, that's very good. Okay, so that about covers the curse questions. Hexes and that. Now let us move on to the lycanthropy exam. Lycanthropy. Werewolfism, the curse of the werewolf, it comes into full lunacy. We're going to check if you have lunacy. Let me put my clipboard down. Okay, now I have a plethora of different things that we are going to try on you to assess if maybe you have been afflicted with werewolfism, the curse of werewolfism. So the first thing that I'm going to be doing, I'm going to take the wolfsbane out of the container. It's wolfsbane aconite, wolfsbane aconite. Just some small sachets of dried herb here. The doctor likes it in her tea. So what I'm going to do is I'm just going to take this sachet and I'm going to rub them on. Do not worry about my glove. I was injured recently and I just, want to get the glove on. You don't want to take the glove off. Don't worry about my glove. It is completely clean. It's fine. Don't worry. I'll keep it on. But don't worry. Yes. don't think that immediate reaction, which is preferable actually. But I'm going to rub all over you just to be sure. Okay. Oh, don't worry about my eye. I can't read the thing. It's completely. I don't know you have a lot of questions. I am the one who is supposed to be asking you the questions here. Okay. I will count these exes. I will not put these back with the other door. I don't think the doctor will like essence of you in her teeth. The next thing we are going to do is to do lycanthropy. I just need to have a look at your palm. Okay? So, what I am looking for here is 3-5-pointed star on your palm. Not seeing any of the telltale dots that would tell me that your penis looks good. They might take a little bit of time to show up depending on when you were bitten. So it is better to check now and see if there are any kind of indications so that we might get you under lock and key before you attack one of us. So the next portion of this exam, I will be taking a sample of your hair so that I can run it through the computer. If you do not wear wisdom, we must procure it. We might be able to figure out the code in your follicles. So I am just going to my little tube here to select the hair, and I'm just going to open that up. Take a couple don't worry about my gloves, they're completely clean. Just going to take a couple of these samples here, and I'm just going to take another one from over here. Maybe take another one from over here. Just I have it for the data sets. Very important. I'm sure that we can also check out in your review to see if you have any other underlying conditions that we might want to be nervous for later. So, not to get you out, but the computer is very powerful when it is reading all of the different samples. So I will put that aside with your file. And the final test that I am going to be administering just have this silver cigarette case here, and I'm going to press it to your skin to determine if there is a reaction. Okay, very simple test. 3, 2, 1, go. Ooh. How did that feel? So sorry if I injured you, but we must test again to see if it produces a similar reaction. Yes, please give me your hand again. Maybe a different hand. Good. Now, okay, no, that is something that the doctor definitely will want to know. I I must record these results. You know, I thought that nothing was going to happen, but it is good that we have produced some results from these exams. Obviously, the first questioning was a complete debate besides question number 10. I still want to look into the technology that you have been playing with recently. I think it may have affected the microchip they implanted in you. We will know for sure after your chip is done being defragmented and read. So, yes, it was so good to meet you, little lab rat. And I will have to tell the doctor your results, and she will say what happened. I will say yes, doctor, and I will show her what I have just written down now. So it was very nice to meet you, little lab rat, and we will probably be seeing each other again sometime. Don't worry, I will keep an eye out for you. Oh, well, you're not a lab rat. You're not even a mouse. Huh. I was worried for a second. Nice to meet you. My name is Nurse Kitty Newmar, and I am the mutagenic specialist here at SOS. Yes, my specialty is genetic mutations and their evolution. So I am going to be running a few mutation labs on you, if that's all right. I may need to get a little bit more up close and personal, if that's okay. But I will be touching you. Do I have your permission to touch you? Okay, good. If you have experienced any mutations, it's good if we catch them earlier than later. So that's why I want to run these labs on you. So the first test that I'd like to do on you is an ENT swab, just to make sure that you haven't experienced any bacteria that would lead to a viral outbreak, sort of like a zombie infection. Yes. We can run that through our computer along with anything else that we may acquire from you and add it to your file. So, how's that sound? Yes, I just want to swab your ear canal, your nostril, and the back of your throat first, if that's okay. Okay, I'm just going to swab around your ear. Don't worry, I won't pierce your eardrum with the Q-tip. I would never go that deep. That would be insane. So let me just. Okay, good. And I'm just going to put that in my tube. And I'm going to swab your nostril next. So just get in there. Your nose. Okay, good. And then the big one. Okay, so I just need you to open up your mouth and say, "Oh, don't scream, just, oh, okay." Okay, don't worry, I won't try to hit your gag reflex. Okay, good. And I will get the big tube for this one. Okay. So according to Dr. Yancy, you were found outside of the SOS base near the dump somewhere. I just want to check you for radiation poisoning, so please just hold still. I'm going to scan you. as you can probably tell, those are radiation counters as well. You could probably hear the sound, and you do have a slight bit of radiation, but nothing that would cause any sort of mutation, just a little bit of sickness. Are you feeling nauseous by chance? Okay, I can give you a Tums after this, and that should probably clear it out. So in the next test, I'm just going to palpate the back of your neck. This is to check for a botanical mutation. Yes, if you've got any sap back there. So let me just come in a little closer. Okay, so I'm just gonna check behind your neck here for some sap. And while I'm back here, I'm also going to look for any kind of gills or mucus. So sap, sticky sap, and slimy mucus to check you for any kind of botanical or amphibian mutation. Doesn't seem like you have any gills. Your skin is very nice. So, yes, the next test I'd like to perform is for reptilian mutation. So I'm just going to brush your face and see if there's any scale shed. Okay? Let's see. Usually mutations that are animal in nature start in the T-zone. So it's very important to catch them before they advance, especially animal mutations. I'm not seeing any scale shed. The next part of reptilian mutation is the development of back ridges. So let me just put this aside and I'm going to check your back. I'm just going to palpate it, okay? Alright, now I'm just going to palpate your back and check for any kind of ridges. Down your spine, the top of your skull, all the way down. Usually the vertebrae starts to extend into sort of a back fan, like a spinal mohawk. So I'm not feeling any bone spurs, so that's really good. Okay, this next test that I want to try, I feel like you're not experiencing this mutation, but I still have to run the test. Avian flu, so I'm just gonna check your scalp and see if you are developing any feathers. So I just need to check you for feathers, but my sixth sense tells me that you don't have avian flu, but I have to check anyway, so. Seem like you have feathered hair. Just had to check it off the list. Next, I'm going to perform a series of scans to your body, but mostly your head, to see if you're experiencing any form of alien mutation. First thing I'm going to do is scan you for parasites, and then I'm going to scan you all over just to track if you've been abducted recently.
darling, I have returned. Yes, I believe we do have some results. I've watched all of your playback in quadruple speed. I believe I know exactly what happened to you, along with some of the results of your earlier diagnostic. I'd like to confirm some things. So, if you wouldn't mind, just one more round of testing with me. The test that I would like to administer to you is for vampirism. Yes. You don't mind, do you? Good. So first and foremost, I would like to get a blood sample, if I may. However, my methods may be slightly unconventional. These are leeches. Yes, blood sample leeches. With monsters, paranormals, and supernaturals, you cannot use syringes. In order to permeate the flesh, you must use something that is natural, and leeches are perfect for that. And I'm going to stick it right here. Exactly. You can't feel a thing. So the wound will be alright. I'll try to pull it off. However, if I can confirm my suspicions of you, I think the wound will clean and heal with ease. Very good. I will take this to the laboratory after we've finished your exam. Alright, my darling, now that I've lowered the lights, I am just going to place this ruler here, and I need you to tell me how many times I tap this. How many times? Very good. How many times? How many? Not many people know, but vampirism is associated with the compulsion to count. Yes, and I'd say that you did aces on those. Yes, my dear, we'll stay in the dark for just a little bit longer. It is quite nice though, isn't it? Now, can you tell me how you feel about this? Yes. Oh, it is very pretty. Quite fresh too. Type O negative. Oh, I'm quite positive. Now, what if I brought it slightly closer to you? All of the information I revealed. How does that make you feel? Beware. I do have a light cannon and I know how to use it. I've been wandering around nowhere for quite a while. Yes. Yes, darling, I'm sure it does sting. But you were advancing on me. What else was I supposed to do? You had the bloodlust upon you. 2 final tests. Yes, of course, my dear. I will give you the blood bag later. could have it like a Capri Sun for all I care. I'm sure you could smell this next test a mile off, but I have to do it just to be sure and confirm my results. So I hope you don't mind. Yes. Yes, I'm just going to press this on you. And but just once more here. Alright, yes, that's what I suspected. And one final test, my darling. Can you see yourself wearing this? I will help you put it on. Ah, no, I will not. Pure silver, yes. And it is covered in crosses, but yes, silver. Same results as earlier. I'm sorry, I know it all stings very much, but we had to confirm the results. So, to recap the playback on your microchip, it seems you have come down with a case of malware. Yes, so we would like to defragment that for you after we cure your vampirism. Oh yes, that happened only 24 hours ago, so we should be able to catch it early. Yes, that is why we performed all the tests, so we can do a workable treatment plan for you. So what I'll have to do is I'll have to sedate you, and in order to defragment the microchip and remove the malware from you, we might have to extract it. Yes. You'll be completely sedated out of it, so don't worry. Well, sedated is a word for it. Yes. I'm going to put you to sleep. Yes. Now, as I said, we cannot do any injectables or any unnatural methods of anesthetic. So what I will be doing is using the counting compulsion of your vampirism against you. Yes, I would like for you to watch my hand movements and try to count them. As I said earlier, vampirism unfortunately beholds you to this compulsion. So you simply cannot resist, and as you count, you begin to relax.